Hi, my name is Dr. Patrick Murphy and I'm a consultant respiratory physician at the Lane Fox unit, Guy's and St Thomas's Hospital. And I'm here today to talk to you about the Duchenne Standards of Care guideline relating to respiratory monitoring in Duchenne muscular dystrophy. I think the first thing to understand is why respiratory monitoring is important in Duchenne muscular dystrophy. And like any muscle group, the respiratory muscle pump can be affected as Duchenne progresses. As the respiratory muscles weaken, it can be harder to take a deep breath in, and eventually patients move towards respiratory failure and the need for respiratory support. As Duchenne affects all of your muscle groups, the progression towards respiratory involvement often is associated with decrease in general function as well. And this is important because there's a lot of reserve in the respiratory system, and therefore it may often be that people don't have significant symptoms even whilst losing significant amounts of their respiratory function. This means it's vital for us to monitor your respiratory status over time. There are a number of different ways of monitoring respiratory function, and we can do both tests during the clinic visit, but also some tests at home, and they measure slightly different aspects of your breathing capacity. One particular important area is looking at breathing during sleep. This is relevant because everybody's breathing is a little bit worse when they sleep, and therefore this stress to the respiratory system offers good insight into whether there's significant reserve or not. When patients start to have difficulties with their breathing overnight during sleep, it gives us a window of opportunity of between 6 and 24 months when we're able to further and more closely monitor their respiratory function and look to start respiratory support prior to a crisis point and avoid a hospital admission. Now, respiratory support in the terms of non-invasive ventilation can often be a difficult and challenging time, and it offers a pivot point in people's care where they may require extra support. It's therefore important that when delivering this, there's a range of specialists involved in that care planning decision, and that will involve specialist nurses, it'll involve specialist physiotherapists, as well as respiratory doctors. As the muscle function changes, the amount of support you may need also changes from the respiratory device. As well as being used for breathing, the respiratory muscles help with cough function. Cough is important because it helps to clear debris from the airway, and this is important particularly during respiratory infections. If cough function drops below a critical level, it greatly increases the risks around infections and increases the risk of hospitalisation and need for intensive care admissions. Therefore, we'll provide support to help with cough function, and this can usually form either a lung volume recruitment bag or a special machine called a cough assist device. And these help clear the airways and prevent respiratory infections and the need for hospital admission. Similarly to ventilators, they require a degree of specialist input both for training and for use, and therefore it's important that the respiratory team monitoring you has experience in these devices. In terms of long-term respiratory care, the respiratory monitoring is essential because it can improve both quantity and quality of life for patients with complex neuromuscular diseases such as Duchenne. So in summary, we'd just like to say that the respiratory monitoring of patients with Duchenne is a vital aspect of their care, that the teams involved in that monitoring should be made up of a number of different specialists with experience in this area, and they should have access to both ventilators and cough assist devices to help support your respiratory needs. It's also important for you to realise that that monitoring will be required even if you don't have significant symptoms, because a degree of respiratory loss can go unnoticed. I hope that was helpful. All the best.